Hello and welcome to this week's IRQTC Training Tips newsletter. I'm Brian Traskos, the founder and director of the Institute for Rehabilitative Qigong and Tai Chi. This week we're going to talk about using Tai Chi for knee rehabilitation. Now there was a recent study that came out that compared Tai Chi to physical therapy for people dealing with osteoarthritis and specifically knee pain. This is actually the second study that I've seen in regard to this. And at the result of both of these studies, both groups, the Tai Chi group and the physical therapy group, showed equal improvements in functional abilities as well as decreased pain. Now, the one extra bump that the Tai Chi group got is that those people also rated less depression and higher health-related quality scores. And this makes sense because we know that Tai Chi is a body-mind practice. And we're not just affecting the physical body, we're also affecting the emotional body as well. So there's something to be said for that. But going back to simply the physical function for a second, we could stand here and talk for a long time about which one's better, PT, Tai Chi. But, I think why not bring them together? Why not combine both of these modalities, both of these ideas, and get the best of both of them to help people physically, emotionally, energetically, spiritually, on all levels. So with that said, I thought today, in the spirit of cooperation, of bringing PT and Tai Chi together, I would love to share with you one of my favorite Tai Chi for knee rehabilitation exercises that we do in our clinic and in our practice. Now this exercise actually comes from our Rehabilitative Tai Chi for core and spine stability program. And I'm going to fill you in on why in just a second. But let me move back and show you some things. One of the things that happens when we have a knee injury or even knee pain or even a little bit of swelling on the knee is that the body begins to do things differently. We start to have compensatory patterns happen all throughout the body, but especially around the knee in this case is this. The muscle on the medial side of the quadriceps, called the vastus medialis, will actually shut down. It will actually quiet down and become what we call inhibited in its function. The muscles on the outside of the thigh, the vastus lateralis, the tensor fasciae lata and IT band will actually, the IT band will activate, but the tensor fasciae lata up here will activate and tighten the IT band. But the muscles on the outside of the thigh get, basically a little more activated, and the muscles on the inside of the thigh get deactivated. Moving up towards the hip, what happens is the muscles out here on the lateral side of the hip, gluteus medius, turn off, and the muscles on the front side of the hip flexors, turn on. So we get all these imbalances beginning in the whole lower extremity after we've had knee pain, knee injury, or even a little bit of swelling on the knee. So one of the best ways that we've found to help approach this particular problem and strengthen the knee, the idea is that we want to reactivate, re-strengthen these medial aspects and help to disinhibit the activation on the lateral sides. So we use one of the exercises called horse stance with core pumping for this particular idea. Now the other thing I want to mention is that there's a fascial line. There's a line of connective tissue that connects muscle systems to bony attachment points that runs from the medial side of the leg, all the way from the medial side of the foot, up the inside of the leg, up the inside of the thigh, and then up into the perineum and then comes into the body. The myofascial meridian groups call this the deep front line. And this line actually is very important when we want to kind of think about creating structure and strength, especially in the knee joint. So we enter into our horse stance. Now horse stance, feet are maybe just a little bit wider than the hips, feet pointed straight ahead, or if more comfortable, angled out, but no more than 10 degrees. So you can have a slight angle out, but no more than 10 degrees. Next idea is that we imagine that you're sitting on a horse. Now, if you've ever looked at a horse's back, you'll notice that it's rounded. It's not shaped like a steeple. So your crotch, you want your crotch to have this rounded shape. We know that arches are stronger than steeples. Right? When you look at any architecture, a rounded structure stabilizes and has more strength than a steeple type structure. So we don't want the knees to be like this and be like an A shape. We want to think about rounding the crotch, which means we're going to need to bend a little bit in that system. So relax the knees. Always keep the tail settled and the head lifted up towards the sky in our basic Tai Chi Qigong posture. Right, next, we bring the hands towards the front of the body, just about heart level. And the basic movement to start off with is simply just a little mini squat and then coming up. Okay, so that's the basic movement to start with. just a mini squat, and then come up. And when I squat down, I just open my hands a little bit. And when I come up, I bring my hands a little closer together. You'll see why in just a moment. Now, when I come down and I open the legs just a bit as I'm squatting down, I still imagine that I'm on a horse. Now, when I come back up, what I'm doing is imagining that I'm gently squeezing that horse between my thighs, which is going to keep me in an arch shape, but it's also going to begin activating these medial thigh muscles. And you can actually put something between your legs to do this. Put some pillows or cushions or something between your legs to do this, so that as you come back up and you imagine squeezing those pillows or cushions, you'll feel the inside muscles of the thigh begin to activate, which is really critically important to help stabilize the knee and decrease pain in those structures. So it's just a simple now down, and when we come up, think about squeezing that horse and keeping the arch between your thighs. Come down, and then keep that arch between your thighs. The depth of the squat initially, keep it small to start with, and then slowly progress the depth of the squat, remembering some key things. Always making sure that the tail is settled, right? So the spine stays upright. And the other thing is that knees are never going in front of the toes. That would be more dangerous for the knees. So from the side, it basically, we're here. Okay, we're kind of squatting back and down, dropping the heels like you would if you were riding a horse, and then squeezing the horse as we come back up. That's going to help to keep the knees safe. All right, now here comes the secret weapon part. This is why it's in our core and spine stability program. Because that fascial line that comes all the way up from the floor, up the inside of the leg, up through the crotch, it comes into the pelvic floor. Okay, so we want to activate pelvic floor strength as well to help lift the vastus medialis, lift it up in, pull that fascial line, help create more strength inside of the arch between our legs. So now it looks like this. I'm going to drop down, and I'm going to inhale, relax my pelvic floor, and then when I come up, I'm going to not only imagine squeezing the horse, but I'm going to squeeze my pelvic floor as well. Squeezing the pelvic floor is essentially like you're trying to stop the flow of urine. Okay, so that's the idea, like you're trying to stop peeing. Inhale, I drop down. Exhale, squeeze the horse, squeeze the pelvic floor. That's the exhale. Inhale, relax. Exhale, squeeze the horse, squeeze the pelvic floor. One more time. Inhale, relax. Exhale, squeeze the horse, squeeze the pelvic floor. A wonderful way to start beginning some strengthening through that medial aspect of the thighs and the knees all the way up into the core of the system, helping to increase strength in that vastus medialis, increase stability throughout the hips for the gluteus medius, and ultimately helping to decrease pain in the knees. This is one way we can bring together the worlds of physical therapy and Tai Chi to help people in a more broad and holistic way. Thanks so much for joining me again this week for our IRQTC Training Tips newsletter. We'd love to see you in a program real soon. We'd love to hear from you. We'd love to hear your comments. So make sure you comment below and let us know if this video is useful for you, and make sure to share it with your friends. Thanks so much. Have a great week. See you soon. Bye.